Hello everyone, I'm Kibin Alleyne and today is Tuesday, December 17th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. December is Seasonal Affective Disorder Awareness Month. Also known as SAD, this is a type of depression that's triggered by a change in seasons, usually when fall starts. Symptoms include depression, fatigue, hopelessness, and social withdrawal. Here to help spread awareness about SAD is an attending psychologist for the Child Psychiatry Outpatient Department at Montefiore Health System, Dr. Jenny Seham. Doctor, thank you so much for joining us.
Thank you. It's great to be here.
Now, can you explain or tell us a little bit more about seasonal affective disorder and how it manifests in patients?
Sure. Very important this season as seasonal affective disorder is a depression. It is a mood disorder. And it is, as the name suggests, it is really reliant on the season. So it usually starts in late fall and runs throughout the winter until the seasons change again and there's more light. So although it really mimics the symptoms of depression, it really is unique to this season, but can be very, very serious, very severe. And so it's great to shine a light on it.
Now, expanding on that a little bit, I know you said that it kind of differs a little bit from what we traditionally know about depression. Can you tell me a little bit more about, maybe what are some differences and
Sure.
what they look like?
Yes. So it is the actual diagnosis is dependent upon the season, and those symptoms can go away once the spring happens and there's more light and there's more the days are longer. So that's what really distinguishes it. But what's really important to know is how impactful that daylight and that change in daytime can be on our body.
Now, is there a specific population or age group more susceptible to SAD?
There is. What the research is showing is that women are more susceptible than men, and that people between the ages of 18 to 30 are more susceptible. I want to say, though, partly we don't have enough research on children. It absolutely impacts children and teens, but we may be overlooking it, and we need to take a look at them and take care of them as well.
And I want to expand on that because I feel like our society, we're thinking about mental health in a different way. We're including children in that conversation now. If this is the case, how may SAD present in children or teenagers compared to adults?
Right. So in children, you may see an irritable child and an irritable adult, and they may look a little different, right? And so sometimes even in our practice, we will see parents bring in kids because their behavior and they're out of control, or the school might have said something. And what we uncover is that there's depression happening, that there's irritability or boredom because there's fatigue, there's been this impact on concentration, tiredness, there's been an impact on their eating behaviors, there's been a huge impact on sleeping because there may be an excess of melatonin, or there may be a decrease in serotonin, which is kind of known as the happiness neurotransmitter. So in kids, this may look like, they're bored, or they're a teenager and their hormones. Absolutely, they're a teenager and their hormones, but the light change, the daylight change, the circadian rhythm change is making this impact, and they may not be able to talk about it, so we need to talk to them and find out what's going on.
Now, I want to talk about the role that climate change, climate plays in SAD. Can you tell us a little bit more about that? And, also, people think of this time as like the happiest time of the year. How could that also be contributing to someone's overall mood?
Yeah, I'm going to take the second one first because I think there's a great expectation, right? It's the holidays and everyone's happy and that's what's on TV and yay, it's Christmas and it's Thanksgiving. And that when somebody is feeling down, that can really contribute to negative thoughts that can perseverate in somebody's brain, right? Like, I'm not feeling happy. I'm not feeling okay. What's wrong with me? There must be something that I'm not doing, or I'm a bad person, or I'm worthless. And what is really happening is that there's a change. There's been a change in our body clock when somebody's experiencing that. For all of us, our body clock changes. That impacts mood, that impacts sleep, and that impacts concentration and hormone activity. So there is actually changes that are happening that really make it hard for people to feel happy. So, you know, that kind of leads us into some of the stigma about mental health, or saying that something is wrong when you just feel like, oh no, I'm just lazy, or I'm just, you know, a bad kid, or a bad parent.
Now, how does this, mood disorder affect people in urban settings like NYC?
Yeah. So when we think about sunlight and time to go out, and because being out in the sun really is impactful on our well-being, right? There's a production of vitamin D, which is one of the aspects that is reduced because we don't have enough sun. So think about being in an urban setting, and I'm in an urban setting too. There are tall buildings that block the sun, in addition to the change in hours and the change in the sunlight. Tall buildings, also things get dark, right? And so we say, go out and, take a run, or sometimes that's dangerous. Sometimes we don't really have access to nature, to something that is going to help us feel good. But there are solutions. There are definitely solutions.
Now, I want to talk a little bit more about the solutions. So, what are some treatments or interventions that are most effective for managing SAD or SAD in children and adolescents as well as adults?
Yeah. Most important is to get the sunlight that you can, right? And the very best that we can do is families doing things together, because interaction socially, or also having your kids have play dates, or teens have going out with teens. We all spend a lot of time on social media, and there's a lot of benefits to social media, but when we're feeling down, this is not a time to isolate in the room. This is a time to go out and get the sunlight we can. So activity, exercise, as much sunlight as possible, and socialization. So the second level is therapy. If this is something that's persisting, if this is something that you are feeling all day, every day, and it's been lasting for 2 weeks, that's a depression that really needs attention. So the other thing that's available is talk therapy, evidence-based talk therapy. And one of the strongest is cognitive behavioral therapy, or CBT. And one of the things that does is really address the negative thoughts that we have. I'm worthless, I can't, I'm fat, I've been eating too much, and I can't control myself, to address not only with psychoeducation about what's going on with SAD, but also with really targeting these negative thoughts. The third thing is light, is actually getting a light box what they say is that it needs to emit 10,000 LUX, which is the measure of the light intensity, right? And do not look at it directly, and preferably get a prescription for this, or you don't need a prescription, but talk to your provider about it. But it really makes an impact. 30 minutes in the morning, kind of changing what you used to have when the sun was shining, makes an impact. Fourth is psychotropic medication. So I mentioned before that one of the neurotransmitters, serotonin, that's something that is encouraged and produced by being out in the sunlight. When the sunlight's not there, we're not producing that, right? And so there are medications that kind of replace what we're missing. The last thing I'll say is vitamin D, which is something that also decreases when we're not out in the sunlight. But again, that's something that you should talk to your provider about, because sometimes that interacts, even though that's a good vitamin to have, it can interact with other medication.
Now, I want to talk about the stigma surrounding SAD. Can you just quickly let us know what we can do to kind of, step away from that?
Yes. Anytime you can, be a friend, be a parent, be a colleague that is like, how are you doing? What's going on? And educate people about SAD. So we can all do that. You don't need to be an attending psychologist. We can all help people understand that most of us have a little bit of the winter blues, right? In addition to the, holiday happiness, the absence of light and the change in our sleeping patterns have an impact. But we can do a lot in just educating. We can do a lot. And parents also be the model for your kids that, I'm feeling down and I think I'm depressed. So we can do a lot to really decrease the stigma.
Well, Dr. Owen, thank you so much for joining us and kind of educating our community on this.
Thank you so much.
To stay in touch with all of Montefiore's efforts, please go to their website at montefioreeinstein.org. Don't go away, we'll be back with more Open right after this.